Have you ever been called an inappropriate pet name by a patient? Have you ever been touched by a patient? Have they ever kissed you when you weren't looking? Or have they ever asked you for a breast exam? Maybe they've asked you out on a date. Has a patient ever ejaculated on your treatment table while you were out of the room? Sadly, all of these things are actual things that have happened to acupuncturists that I know. And not just one time, but over and over and over again. Even I have experienced some of them in clinic. The amount of harassment that happens in your practice from your patients is actually astounding. Recently, I was giving a live class to my acupuncture students on how to be prepared for inappropriate patients that are going to come into your practice. And when I started to hear all of the stories from my students, along with thinking about all of the stories that I've heard from practitioners over my last 11 years of coaching, I decided to make this video. I want every single acupuncturist, male and female, to be prepared for when this happens in your practice, because there's a good chance that this is going to happen in your practice on a minor level or a major level. And I want you to understand how to navigate these situations with confidence and control so that you are safe and that you feel secure in your acupuncture practice. Now, there are going to be two different types of inappropriate patients that come into your practice, and you're going to handle each of them in a different manner. The first type of inappropriate patient is going to be a mildly inappropriate patient. These patients are going to do things like hitting on you, asking you out on a date. Although this is completely inappropriate for your practice, this is generally done in a harmless manner. However, remember that everything that you experience is going to be specific to you. That's going to depend on your past, what you've previously experienced, your relationship with this patient, how you were raised. It's really going to depend on a whole lot. So if you find something like this in your practice more than mildly inappropriate and it's really upsetting for you, that's okay. I'm gonna first teach you about how to deal with a mildly inappropriate patient, but if this doesn't feel mildly inappropriate to you, it is also okay to respond with a more extreme action to patients like this. Remember, your wellness comes first in your practice always, and the way that you react and respond to a certain situation that happens is okay. But generally, for mildly inappropriate patients, you're going to be clear, you're going to be direct, you're going to tell them that is not an appropriate question for the office, that is not an appropriate question to ask me. I'm not going to entertain an answer to that question or that remark. So you want to confidently, clearly shut them down. And if the patient hitting on you or asking you out doesn't feel mildly inappropriate to you, it is absolutely okay to enforce that firmer boundary, and you can also let them know that if anything like this happens again, you're going to dismiss them from your services. Or if you want to, you can dismiss them from your services in that moment. It's okay. Honor your feelings, honor how you feel. If you feel completely uncomfortable with this patient now, you can let them go from your services. It's okay. Call your malpractice insurance, tell them what's happening, make sure that you chart it in great detail in your chart, and you and your malpractice insurance can come up with a way to legally let that patient go from your services. You are allowed to do that. Never, ever treat a patient at the expense of your comfort. Ever. It is never worth it, and you never have to do that. If a patient crosses the line in any way and you are not okay with it, it is your office. You are allowed to dismiss them from your services. The second type of inappropriate patient that shows up in your practice is going to be flat out harassment. There is absolutely no gray area with a patient like this. It is going to be harassment. If a patient inappropriately talks about themselves, talks about you, starts to ask questions, tries to touch you, or just absolutely anything, this requires a hard boundary immediately. Never give these patients the benefit of the doubt. They know what they're doing, and they are generally trying to push the boundaries with you to see how far that you're gonna let them go. A lot of times when this happens in your practice, you're gonna get triggered with feelings of guilt and confusion. You might start to gaslight yourself, tell yourself it wasn't that bad, they didn't mean it, it wasn't that serious. Be aware that these triggers in yourself are going to come up when a moment of harassment happens. They are not true. Be prepared and be ready to be questioning yourself in those moments. I don't want you to respond from that confused place. This is why we're making this video, so that you are prepared. You're prepared with what to do with patients like this, and you're prepared with what's going to get triggered in you. You will question yourself. You are a healer. Healers are often people pleasers. You are likely going to have a really hard time putting up a hard boundary with someone that has violated your boundary, and that's because of all this people-pleasing programming that's going on. So be aware that that's what's going to happen in this moment. That's why it's really important to have a support group like I have inside the 6-Figure Acupuncturist program, so you can come there 24/7 at any time and get support from me and from your colleagues on situations like this. Because a lot of times when you're in a situation like this, you're gonna second guess yourself. But when you tell us what's going on from an outside point of view, it is very easy immediately to see what's going on and to be able to support you and help guide you through a really uncomfortable moment like that. Now, an inappropriate patient that does something like this, anything inappropriate, they need to be dismissed from your practice immediately. And we're talking immediately, leaving your office, out the door. It doesn't matter if you haven't treated them yet. It doesn't matter if you're in the middle of putting needles into them or if you're checking them out. Get them out the door immediately. Let them know that that is absolutely inappropriate behavior. It is not allowed in your practice. I'm going to have you leave the office right now. If you need to, take the needles out of your patient. This is the only time that I am telling you to allow a patient to leave your practice without paying. This is also a time where you can invoice a patient later on if you want to. If you follow my work or if you're one of my students, you know that we do not invoice patients. We get payment at time of service. But during this time, I don't even want you to take a payment from a patient like this. Just get them out of your office immediately. After this, I want you to contact your malpractice insurance. You need to report what happened. Generally, what's going to happen is that you or the malpractice insurance is going to create a formal letter of dismissal for this patient, and then I want you to never have contact with this person again. Now, I have a whole other video on sexual harassment. I'll put the link up here. I want you to be sure to watch that because you really need to understand how to heal from sexual harassment that happens in your practice. You need to understand how to feel safe in your practice again. Hopefully this video will have you feel more prepared and as prepared as you can, because these moments will really throw you off. It's absolutely okay. Make sure you have support. This is a really serious matter. So make sure that you don't isolate and then start to get all heady and feel guilty and blaming yourself and all this kind of stuff that can happen in situations of harassment. So to recap, for mildly inappropriate patients, you are going to confidently shut them down immediately. And then for harassment inappropriate patients, you are going to get them out of your office immediately. For the harassment situation, you will absolutely report that to your malpractice insurance. For the mildly inappropriate patient, that depends on how you want to handle that situation. If you're just going to confidently shut them down and then carry on with your treatment with this patient, no need to call your malpractice insurance. If you want to have a more firm boundary with them, maybe let them go from your services, call your malpractice insurance. Anytime any of this happens, mildly inappropriate or hugely harassment inappropriate, be sure that you are charting this. Chart it in great detail in your charts. What they said, what happened, how you responded. I hope that this message makes you feel more prepared for this happening in your practice. I don't want you to be scared or anticipating it. I just want you to feel prepared and to know the steps of what to do if this does happen, because it is happening out there, and because practitioners aren't prepared, because nobody's talking to acupuncturists about this, it can really throw a practitioner off, create a lot of confusion and inner turmoil when this happens. I am making this video so that you feel prepared. You know what to do, you know how to respond, and you know what is going to likely get triggered in you in moments when you're dealing with inappropriate patients. Be safe out there. Keep healing the world. I love you. Subscribe to this YouTube channel because I'm going to be putting out more important messages like this, along with other fun videos too. We talk about everything on this channel. So thanks for following along. I'm here for you. I love you. Keep healing the world.